These past few days, COVID is all we hear. This word seems to spark a lot of fear. But what is this case really all about? Watch this video to find out. COVID-19 is a pneumonia-like infectious disease caused by the most recently discovered coronavirus. The virus itself is called SARS-CoV-2, or Severe Acute Respiratory Syndrome Coronavirus 2. This new virus and disease were unknown before the outbreak began. On March 11, its alarming spread of cases has caused the World Health Organization, or the WHO, to declare COVID-19 as a pandemic. As of March 22, 2020, 188 countries around the world have been affected. In Indonesia itself, 514 positive cases have been confirmed, with 48 deaths, and this number continues to increase.
But the story of the virus runs long before that. On December 31, 2019, WHO was alerted to several cases of pneumonia in Wuhan, of Hubei province in China. Chinese authorities confirmed a new virus identified on January 7, 2020. COVID-19 appears to have originated from a Wuhan seafood and live animal market. Some believe that the first people infected were stallholders from the market who contracted the disease from animal contact. However, several early cases demonstrated that the initial human infection route might predate the market cases. On January 21st, WHO said that the disease was being transmitted between humans, supported by the evidence of medical staff that became infected with the virus. Although initially referred to as coronavirus disease, on February 11, 2020, the WHO announced the official name of the disease as COVID-19.
So how exactly is COVID-19 spread? COVID-19 is thought to be spread from person to person who are in close contact with each other. When an infected person sneezes or coughs, the respiratory droplets can land into your mouth and noses or possibly be inhaled into the lungs. That is why we should stay more than 1 meter away from a person who is sick. Moreover, these droplets can land on objects and surfaces and last up to 2 to 3 days on plastic and stainless steel. Other people can catch COVID-19 by touching these objects and then touching their mouth, eyes, or nose.
The amount of time it takes between the exposure to this virus and the appearance of symptoms, or its incubation period, is 1 to 14 days, with an average of 5 days. The most common symptoms of COVID-19 are fever, tiredness, and dry cough. Some patients may have aches and pains, nasal congestion, runny nose, sore throat, or diarrhea. These symptoms are usually mild and begin gradually. Some people become infected, but do not develop any symptoms and do not feel unwell. Most people, about 80%, recover from the disease without needing special treatment. Around 1 out of every 6 people who gets COVID-19 becomes seriously ill and develops breathing difficulty. Older people and those with underlying medical problems like high blood pressure, heart problems, or diabetes are more likely to develop serious illness. People with fever, cough, and breathing difficulty should seek medical attention.
What can we do to protect ourselves and others? We would like to recommend adopting the following measures. Clean your hands often with soap and water for at least 20 seconds, especially after you have been in a public place or after blowing your nose, coughing, or sneezing. If hand washing facilities are not available, use a hand sanitizer that contains at least 60% ethanol or 70% isopropanol alcohol. Avoid touching your mouth, eyes, nose with unwashed hands. Practice good personal hygiene. Avoid close contact with people who are sick. Perform social distancing measures to reduce the social interaction between people. Consult a doctor promptly if you experience symptoms of COVID-19. Wear a surgical mask if you are feeling unwell or have been tested positive for COVID-19.
Indonesia currently has 132 referral hospitals accepting COVID-19 patients. If you have any questions or if you experience symptoms of COVID-19, do not hesitate to contact Indonesian Public Hotline for COVID-19 through the following numbers. And remember to check for updates from credible sources. Our greatest gratitude goes to the front line of healthcare workers of all kinds, doctors, nurses, radiologists, and everyone else. We wish you all nothing but the best.
Please keep yourself protected and your loved ones too. Let's all avoid being affected for a healthy Indonesia anew. Remember, we might be the problem, but we can also be the solution.